Good day. I'm very pleased to be here with the Honourable Marlon Penn, the new Minister for Health. The Minister, I look forward to working with you in line with our respective responsibilities for supporting the people of the territory of the BVI. The United Kingdom has been committed from the beginning to supporting BVI during the COVID-19 pandemic, and we remain committed to that for the future, in particular supplying the vaccines that the territory requires to help to keep people safe. Back in February, a further 3,510 doses of adult Pfizer vaccine were delivered to the territory, and the first pediatric doses were delivered for children aged between 5 and 11 years old. And just yesterday, the 11th of May, a further 200 pediatric doses were delivered in response to the request from the Chief Medical Officer. I should say that most children remain at low risk from developing serious illness from COVID-19, but a very small number may develop severe illness, and hence the pediatric dose can help to keep them safe from that risk. I know that as we speak, Minister, we have 155 live cases of COVID-19 in the territory. I know that most of them are mild cases, most of the symptoms are mild, but the COVID-19 outbreak has not gone away. New variants can arise, and some people, particularly vulnerable people in the vulnerable categories, remain at risk. So I would join you, and I know the Chief Medical Officer, encouraging persons in those categories not to procrastinate. Get vaccinated or get the boosters that you require to keep you safe and to help keep your loved ones safe as well. As I say, we remain committed to supporting the territory during this time, and Minister supporting you and your health colleagues in helping the people of the territory. Over to you, Minister.
Thank you. Thank you, Governor, and thank you for those kind words to the people of the Virgin Islands. Mr. Governor, I have a formal statement I think is important for me as my first statement as Minister to read to the people of the Virgin Islands where we are currently with our vaccination program and where we are currently in terms of the new rising cases and the implications of that. So I'll start, Governor. I'm Marlon Penn, Minister of Health and Social Development, and I'm pleased to lend my voice to this critical topic of vaccination and COVID-19 in this new capacity. Yesterday, additional doses of the pediatric formulation of the Pfizer vaccine arrived in the Virgin Islands. These doses are to ensure that children who have already received the initial dose of Pfizer can complete their vaccination course and be deemed fully vaccinated. The government and people of the Virgin Islands continues to be grateful for the continued support and assistance of the government of the United Kingdom in the Virgin Islands. The response to COVID-19 pandemic, the UK government has and continues to give invaluable support in the areas of vaccine, but also technical support in a number of areas related to public health and the provision of supplies and equipment to support the territory's response to the COVID-19 pandemic. This has included antiviral medications, ventilators, medical supplies, all of which have improved our readiness and supported our response in keeping the Virgin Islands safe during this very difficult time. As the pandemic has charged over the last 2 years, we have seen the emergence of new strains of COVID-19. Thankfully, the current Omicron variant and its associated subvariants, despite being more contagious, continue to be associated with much milder disease than previous variants. This, together with increased levels of immunity in the population, through vaccination and natural immunity, and the sensible application of public health measures, have led to a relaxation of public health measures across the globe, and conversely, the reopening of societies and economies. On this backdrop, responsibilities have shifted from governments to individuals to ensure their own personal safety and make sensible decisions for themselves, their families, and their connections. Vaccination remains a wise personal choice for persons who choose it as one of their strategies for protection. Vaccines remain an important strategy, especially for the more vulnerable persons who are more likely to have severe disease. This includes the elderly and those with immune compromise. The government of the Virgin Islands, with the invaluable assistance of the government of the United Kingdom, remains committed to ensuring that persons who wish to have access to vaccines continue to have access. The arrival and receipt of these pediatric doses of Pfizer vaccination are a testament to that commitment. For this, we and the parents of the children who will receive these doses are grateful. As of 10th of March, a total of 19,299 persons, or 64% of the population, have received COVID-19 vaccinations, with 17,886, or 59.6%, having received 2 doses, and 59.6% having received 3 doses. As the BVI currently experiences an uptick in COVID cases, we report 155 cases today, with a total of 387 new cases being reported over the last month, since the 10th of April. It is important that persons continue to take personal responsibility to protect themselves and limit the spread of the disease in the community. As a reminder, the reduction of public health measures signals a shift from government towards individuals making their own decisions in relation to protecting themselves from COVID-19. Therefore, if you think you have symptoms of COVID-19, do isolate yourselves from others and get tested as soon as possible. If you are positive, you should isolate from others for a period of 10 days. You can do a test on day 7, and if negative, you can end isolation as a precaution. However, all persons testing positive should ensure that they wear a well-fitted mask and avoid contact with vulnerable persons for a full period of 14 days. Persons who have been exposed to a confirmed positive case, meaning that they had close maskless contact with that positive case for 15 minutes or more, should self-isolate and wear a well-fitted mask when around others. They should seek to be tested within 5 to 7 days and continue to observe themselves for symptoms for a full 14 days. Contact with vulnerable persons should be avoided to minimize the risk. I recognize that we have been impacted in one way or another by this disease. However, we must not get wary in ensuring we take care of our most vulnerable in our population, the elderly, and those with underlying conditions, as well as ourselves. Let us all continue to remain vigilant, as we must coexist with this disease. Thank you, and God bless these beautiful Virgin Islands.
Thank you, Minister, and I join you in that message, and thank you for your ongoing work.
Thank you, Governor. Thank you for the support from the United Kingdom and support from you personally as we work closely together to fight this dreadful COVID-19 pandemic. I thank you.